it's going to encompass cardiac, gastro, and respiratory. So make sure you know some things like the tetralogy of Faro. Make sure you know that. Know those different defects. We had a couple defects: transposition of the vessels, ASDs, VSDs, tricuspid atresias. So kind of features of each of those. And then we kind of talked about, well, you know, are they left to right shunts, right to left shunts? There's a potential for shifting. So remember Eisenmenger's syndrome there. You know that. Review. There was a quick little slide on the coronary artery occlusions and the downstream effects. It's more pathoanatomic, if you remember what anatomical area that artery would feed. You should be able to make some clinical correlations there. Then there was a little table of cardiac defects and how they're associated with different syndromes, like Downs, Marfan's, Turner's, things like that. So there were some associations, know those. You might see some case types. And so I'll give you a little blurb about, you know, so-and-so is a blank-year-old person who's got da-da-da happening. You know, what's happening, what do you think the pathology is, what's changed, so maybe what's the pathophysiology, rather than naming the actual pathology, what's the change maybe. Which of the categories had the early cyanosis, which one had late cyanosis? So a lot of those left to right, right to left features, make sure you get those hammered down pretty well. Some questions on atherosclerosis, so we reviewed that, risk factors, and how is the process triggered, things like that. Review cardiac tamponade. Rheumatic conditions that lead to heart changes. Remember we had endocarditis, myocarditis, pericarditis. You know, was there some kind of microbe that played there, or virus that played there? We talked about coarctation of the aorta, some features of that. In the GI section, know some features of achalaisias, GERD, varices, Mallory-Weiss, you know, all those changes there. There's unique things about them. Plummer-Vinson syndrome. The esophageal adenocarcinoma. The two types of gastritis. Remember we had erosive, non-erosive, so features of those. There were some things that cause intestinal blockage, so reflux, or even GI blockage. So atresias, esophageal atresias, intussusception, volvulus, herniations. In the lung section, you'll want to know the different lung pathologies and how those lung numbers, those volumes and capacities, how do they change? ARDS and NARDS will be on there. Atelectasia. And how to differentiate pneumoconiosis from pneumonitis. In the malabsorption section, be able to differentiate features for the different etiologies: celiac sprue, tropical sprue, disaccharide deficiency, i.e. Leonard-Hofstadter syndrome. You guys know Leonard-Hofstadter syndrome? Only one of you? You guys don't watch Big Bang Theory? Leonard Hofstadter, put some cheese on his hamburger, and there's a couple slides on malabsorption. Definitely going to ask you a couple questions on the different types of ulcers, gastric ulcers, duodenal ulcers, the features of each of those types of peptic ulcers. I'll ask you to compare and contrast Crohn's, ulcerative colitis. You know, this is a feature of Crohn's, this is a feature of ulcerative colitis. This is one that both share. And then the different pulmonary, different COPDs, they have some unique features. So, you know, is blah 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 feature, is it chronic bronchitis, emphysema, asthma, bronchiophagia? Maybe it's two of those. So things like, you know, how they might look clinically, tripod position, blue motor, things like that. And that is it. This is a 100-question examination. We'll keep it there. Got to write a question about Reyes syndrome. I won't get on this time. Questions on the question?